and Vice President J.D. Vance says pregnant women should consult their doctors concerning the use of a key pain reliever. This was after President Trump discouraged women from using Tylenol because of potential links to autism. So let's check in with Dr. Marc Siegel, Fox News senior medical analyst. I'm sure your phones have been burning up. Let's listen to J.D. Vance from yesterday.
We've got to follow the science wherever it leads. And, you know, in some cases, that means that we should probably be a little bit more careful with some of these medications. I think being a little bit more mindful of these medication side effects is a good thing for everybody. But ultimately, whether you should take something is very context specific. And that's why I think you should lean on your doctor.
So as our doctor for the segment, what is your advice?
Well, they made it very difficult for doctors, let's face it, because acetaminophen is the most common ingredient in over-the-counter medications, and everybody's familiar with it for decades. But when you start putting out premature warnings on it, especially to pregnant women, which is a very vulnerable group, where I'm already telling pregnant women, take less is more. You know, we try to keep pregnant women away from taking a lot of medications unless they really need it. So we already knew that. Dana, we already knew that. We're not popping medications or pushing them on pregnant women. We only use antibiotics if we're really sure it's an infection. But the problem is that high fevers have been associated with neurodevelopmental disorders too, and this has not been associated with it. It's in the early stages of let's do more study. And then we find out from the Wall Street Journal that the lead author of the study they've been leaning on that was published in August was actually defending the plaintiff, or actually was testifying on behalf of the plaintiff in Tylenol trials. So this is incredibly premature. I'm glad they're looking into the effect of acetaminophen on pregnancy for one reason, and one reason only, which is the current guidelines say you could take up to 3 grams, which is the same amount that an adult uses who isn't pregnant. I think the dosing needs to be looked at, but when you put out an FDA warning like this and then say, go ask your doctor may be worried about saying, go ahead and take it, and then what happens if the person gets sick and starts blaming it? It's a mess. It's a total mess. So just saying to ask your doctor isn't the answer. It used to be the answer. Now it's a problem.
So in 2017, apparently, this is a tweet that Tylenol put out, and it said, we actually don't recommend using any of our products while pregnant. Thank you for taking the time to voice your concerns today. And that was 2017. I don't know all of the context, but what would be the reason that you would put out a tweet like that if you weren't concerned?
Well, they may have been concerned, and I want to point something out. This is why the studies have been going on. A study out of Scandinavia last year looked at over 2 million siblings and didn't show an association between acetaminophen and autism, but autism isn't the only issue. The issue here is that Tylenol or acetaminophen is metabolized through the liver, and a fetal liver is not fully developed. Developed in the liver in a fetus or in a newborn, not fully developed. So I'm not loving the idea of giving a lot of Tylenol to newborns or during pregnancy. That's a different issue, though, than what we're discussing today, which is what is the ramifications of doing it. I would tell my patients now not to take a lot of it, but also to be concerned about fevers, especially during the first and second trimester. It's all a risk-benefit analysis that doctors do with their patients. And when the government gets involved, it should be because they're sure that there's a major issue going on here. They're on the right track to study this, but they're premature.
I imagine that some of these pregnant women on TikTok, they were showing some videos of themselves downing Tylenol in spite of the guidance, the new guidance, or in spite of maybe like asking their doctors. I don't know if they could pull up that video. We have it here from TikTok. We don't have it. Okay. Well, believe me, it exists. Also want to ask you about this. There's a nightmare bacteria apparently that's coming across America. There's a 70% increase from 2019 to 2023. What is this nightmare bacteria that we need to be worried about? How do we protect ourselves?
I mean, it's had a 5 times increase in the last several years, 70% in the last 3 years. It's a carbapenem-resistant bacteria. It has a certain gene, and the viewers need to know that bacteria have genes just like we do, and they're trying to get the combination to the vault so that the antibiotic you give them doesn't work. And drug resistance has become an increasing problem in the world, especially among bacteria, because, Dana, we don't have enough antibiotics, and we don't make them enough, and they're not profitable for drug companies to make because we don't use them enough. So I'm still using antibiotics from the 1980s. This particular bug does concern me because the only 2 antibiotics we have for it, you have to use in the hospital. And we're not even on the lookout for these infections early enough. So this is a wake-up call. Be on the lookout for these infections.
What are
Let's
the
get more drugs
symptoms?
in the pipeline. Let's use artificial intelligence to develop new antibiotics to fight this bacteria.
What are the
and the
symptoms?
other thing, let's not overuse antibiotics in the hospital because that creates the drug resistance.
Can you just give us a couple of the symptoms that people should be on the lookout for? You might not. Hi, Doc. I don't know if you. I'm sorry about that, guys. Doc, can you hear me?
What was that?
Oh, I just was curious.
Yeah,
What are the symptoms, or a couple of symptoms from the nightmare bacteria that we should be on the lookout for?
We see urinary symptoms from this. It can be a bloodborne bacteria, and it also can cause lung infection. So be on the lookout for early urinary infections and lung infections.
Okay, thank you so much. Sorry for the quick technical difficulty. Glad we got it fixed. And thanks for your expertise. Appreciate it.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.